Hi, this is Peggy with Natural Awakening Chicago Magazine. Welcome back to our Women in Wellness feature. We're doing a video series this month to go along with our print and digital publication, talking with women in wellness, women healthcare practitioners in the Chicago area. And today I am pleased to be talking with Dr. Meena Malhotra, MD. And Meena is a founder at Heal and Cure and Dr. Meena. Her office is located in Glenview, Illinois. And she is a functional medicine practitioner, empowering patients and providers to collaborate to address the underlying causes of disease. Welcome, Dr. Meena.
Hello, Peggy, and hello, everyone. I'm glad to be here.
Yeah, I'm thrilled to be talking with you today. I really love your approach that you are working with people to try to get past disease management programs and that you're really working with your patients, men and
You
women.
are, yeah, you're absolutely right, Peggy. It's almost time that we start working on the root cause of the problem instead of masking symptoms. Almost 50 years ago, we applied this approach for infectious disease, and that changed the medicine for good forever. you know Instead of masking the fever to bring it down, we found where it was coming from. We used the antibiotic, the root was gone, patient was well.
Mhm.
Now we have to start doing the same for chronic disease like blood pressure, cholesterol, diabetes. Instead of using a chemical to keep the numbers artificially low or where you want them to see, while the disease process is going unregulated inside, the end organ damage is still happening.
Yeah.
We need to get to the root cause of the problem, which is most of the time visceral adipose tissue or fat inside your organs, which is what produces that inflammation, which is what causes the issue. And once we address to that, these things go away, just like when we use an antimicrobial, the problem goes away from the root. So it's
You're-
almost time we use that approach.
Yeah, so you're talking reversal rather than just managing symptoms.
Correct. And reversal is strong. Sometimes you might have just let the water rise too high. But if you are proactive, if you start in time, uh, yes, most of the chronic disease can be turned around.
Yeah. And I know you do treat many, many things and you do work with people on many conditions, some of them obesity, menopause, diabetes, depression, anxiety, thyroid, things that women are seeing so much these days. Heart disease.
Peggy, the once again the root cause for all these symptoms, what you said is saying. The root cause a lot of time is visceral adipose tissue. It is the toxicity which builds in your system. And all these things fool with your mindset, the hormonal fluctuation. So once you have the energy flow efficiently in your body,
Mhm.
through your gut, through your liver. It goes inside the cells, inside the mitochondria efficiently, and actually we can convert that food into energy. You start feeling better. And whether you have to lose fat or gain muscle,
Mhm.
that happens automatically. It's not a separate issue.
Yeah.
The goal in functional medicine and our approach is to make the energy flow in your body efficient, and when that happens,
Mhm.
your body is a little bit more forgiving. You remember your teenage years,
Yeah.
when you could party a little more or sleep a little less, but next day you were still okay. But as the time goes by, the toxicity builds in,
Mhm.
the visceral adipose tissue builds in. Now all of a sudden, your body's not all as forgiving,
Yeah.
because the energy flow is not efficient. And so the first step, once you do this slowly, what you said earlier, the chronic disease symptoms,
Yeah.
those things start getting resolved and turning away. And you'll
Mhm.
start feeling like how you want to feel.
Right. Right. So I'm sure there are a lot of contributors to disease, but
Uh-huh.
can we talk about food a little bit and what
Oh
people
my
are
God.
eating?
Yes. So food is you the food is so vast, Peggy. We can talk till tomorrow and we will still
Yes,
not cover it
we'll have a
all, right? So food is
multi series
really
here.
and we can have fun. We can find people advocating for vegan diet
Mhm.
and for keto diet. And there are people you'll find who will say keto is the best, vegan is the best, paleo is the best. You know, it is not a diet. It is what your body needs at that time or that phase of life.
Yeah.
In for you, it might be some food which is good now, and as things change in your body, or you start doing something else, there might be a different kind of diet needed. Remember, food is the fuel of your body. And I truly believe you are what you eat. So if you eat spaghetti, you are like spaghetti. So, with no tone and flabby and so on and so forth. So if there is one advice on food, which is always right, is don't eat chemically food. Whether you eat steak or whether you eat cauliflower, it really doesn't matter. You can be eating chemically or processed food. If there are foods which has the ingredients which you can pronounce, don't eat it.
Mhm.
Now, those things, it is unfortunate that we have almost more than 2,000 chemicals approved to be used safely in our countries and
Safely.
European Union safely. And you can say it is a point. I mean, it's just a little bit, and in minute quantities, it is not shown to interfere with your function. No, the reason is our body doesn't have the enzyme pathways to take care of that. So if you eat too much of a good thing,
Mhm.
you may be a little large, but you won't be unhealthy. But this thing with you are doing the calorie-free sugar or sweetener or fake butter and all that stuff. Those are all chemicals. We don't have pathway to process them.
Yeah.
And when you eat and it is tasting sweet here, but inside it is doing something else, it gets very confusing signals to the body, and that is where the disease process starts happening.
Mm.
So, whether it is a young child, whether you have to lose weight, whether you have to gain weight, whether you have depression, or whether you have diabetes, it doesn't matter what you have.
Yeah.
But I think it is fair to say eat the food in its closest natural form. It is very, very challenging to eat right all the time. It's almost impossible.
Mhm.
So we have to just do the best and slowly strive for doing better.
Yeah.
So, what works for me is in your pantry, always keep good ingredients. Don't and be brave to experiment. If you put good things together
Mhm.
and it didn't taste that great because you were, experimenting with a recipe, it will still be good for you.
Yeah.
So you can still eat it. But and then as you continue, don't be afraid. Mix and match. It can't hurt. Nothing bad will happen with it.
Right.
But if you
Right.
use the right ingredients,
Mhm.
it's a lot of fun to experiment and venture out in the cooking world.
And get the kids involved too.
Get the kids involved. Oh my God, from very little. Don't leave them with a babysitter to go grocery shopping. Tag them along and let them read the labels and just talk about it.
Yeah.
It is going in that subconscious mind from early on. Yes, that is, you absolutely need it. You have to involve. It's a family event, and that time in the kitchen should be religious.
Mhm.
It doesn't have to be the food. Everyone doesn't have to come once the food is on the table. Everyone can be involved in cooking and preparing, and while someone is on the stove, the other can be chopping the food.
Yeah.
And you have to make it a family event together.
Mhm.
It has to be not only fun to eat when you go out, but it has to be fun when you're cooking in the house too.
Yeah.
Yeah.
So how did you get to this point as a physician? How did your background lead you to functional medicine and taking this approach, this comprehensive approach to wellness?
I, as you know, my training is in internal medicine.
Mhm.
In internal medicine, what you see is chronic disease. And when I started practice, all my practice, I saw diabetics and high blood pressure and cholesterol, whatever. And I was seeing lots and lots of patients, like a belt, just like many of my colleagues still do.
Mhm.
Many patients to meet the demands of the system. Now, doing that, I didn't have time for myself. I didn't have time for my kids.
Mhm.
And, I was eating sad, standard American diet. And I was really sad. We have met. Um, I had maybe 50, 60. I weighed close to 180 pounds packed on me.
Wow.
I was tired, irritable, not sleepy, snappy on my little children. And the answer was this, that what I tell my patients right now. And one day I was rounding in the hospital and I said, okay, Meena, I'm going to do super good today. And I'm going to take the stairs instead of the elevator to go to the hospital floor. Now, one flight of stairs, I reach up and I was huffing and puffing. I reach up there, that moment is etched so well in my memory. It was evening, sun was setting, and as I was walking the corridor, a patient was calling for the nurse help. And nurse was with somebody else, and he just something in the way he was crying, literally for help, and that hit me, that struck me in my heart, and I say, hey, Meena, what are you doing here? I said, hey, I am going to drop dead myself walking these corridors
Mm.
because the way my health was, I was sensing it. I said, neither I'm helping myself, nor my family, nor my patients. Because, you know, you can keep, like we were talking earlier, all these chronic disease numbers looking all good, but you don't feel good,
Yeah.
you know,
No
and you
energy. No.
still no energy, you are tired, you have the brain fog, you can't sleep, can't move your bowels, allergy, so on and so forth. And you end up having the end result like a heart attack or stroke or kidney issue, something like that anyway. What is the point?
Mhm.
I felt so useless that, hey, I'm not making a difference. And that's not who I wanted to be. So I said, things got to change now. And I started what I knew, work on the root cause of the issue. But that takes time. And I didn't have time to, share that with my so-called so many patients I needed to see to meet my quota. So as I'm implementing that on myself, Peggy, I started feeling better. I started looking better. I started acting better with my staff and my patients. And who took the notice first? My patients.
Hmm.
And they said, hey, what are you doing, Dr. Meena? You're looking good today.
Yeah.
What you're doing is, yes, what happened? What did you do? Because that's what I want to do.
Yeah.
And it started just like that. And I said, oh, so I made this change. This is what I'm eating. These are the vitamins I started. And they said, give me that. Sign me up for that. And that's really how it started. And it was a chain reaction.
Mhm.
Amazing results
Yeah.
with no side effects of the medicine, no titrating dose. And before I knew it, as I was seeing those patients back, instead of adding more medicine or, increasing the dose of the previous one, I was telling them, hey, you don't need this one anymore because your blood pressure is so much better. Let's cut this down. Oh my God, how many hugs I received. And it was just amazing.
Yeah.
And that's when I said, okay, wait, that's what I need to do. This is the way I want to make a difference.
Mhm.
in my community. It all begins with one person.
Yeah.
And then I trained further in functional medicine, in pediatrics medicine, and I've been doing that for 15 years.
Yeah. And you opened
Yeah.
Heal and Cure?
Yes. I opened Heal and Cure, and then we started doing all only functional medicine.
Yeah. So, what have you seen change in the last year with the pandemic as far as what patients are coming to you with? What types of concerns, worries, habits?
Yeah. I think they're more aware. I think it was a reality check that they can't take health for granted.
Mm.
They realize that modern medicine, Western medicine is not an answer for everything. They cannot just, health is a privilege. They can't demand it. They can't just assume that they can do whatever they want to do, and at the end, some savior will come. There will be a pill or a surgery.
Yeah.
Some magical bullet will happen which will fix everything. It's nothing
Without
like
work.
that. Yes, without work. You know that you have to put in your effort for health. There is no magic wand. No one has it. And it is realizing that you need to put your part in,
Mhm.
your work in, um, to earn your health.
Yeah.
And once you have it, though, it is addictive because there is nothing like that other than to wake up in the morning and say, hey, I feel amazing. I'm ready to, you know, face my day, live my day, enjoy my day, and make a difference for my community. Um, we are social animals. We live together. We um, rely on each other for the energy. And you can't give what you don't have. If you don't feel good, it reflects. It reflects how you're going to interact with your kids, at your work, in your productivity, with your spouse. It just reflects in every phase of your life.
Yeah.
Um, it all begins with good health. And my my goal is to turn our community into a blue zone. And I know we have been talking about it, and we keep talking about it.
And a blue zone being an area of the world where a higher degree of the population lives longer and is healthier than typical.
You said it. You said it. You know what is sad about it? That in our country,
Mhm.
we don't have any blue zone in the United States. That is really sad. But I believe we can make one because I think our community is ready.
Mhm.
We are ready to imbibe, ready that yes, there is a direction, and if there is some more clarity, and then you start following it, and then you can start instead of just managing diseases, instead of, like you said, reversing or turning around.
Yeah.
I don't like use the word reversing casually because then everyone thinks they can resolve it. Probably you haven't let it go on that far.
Yeah.
So there is a zone in there. But instead of living with diabetes, reversing it, turning it around.
Yeah.
So you can one day say, I don't have diabetes. It's a very powerful statement. It makes you feel good.
So where do you see your role in creating a blue zone in the Chicago area?
Um, I want to partner and with the like-minded,
Mhm.
and you need a community to do this.
Mhm.
For me to um, show the path, and where, because it's not a magic wand,
Right.
it's not a pill, it's a lifestyle, and design um, guidelines for most of us to follow. And once you follow like the curriculum to be a blue zone citizen,
Yeah.
once you follow that curriculum, you're likely to hit all those milestones. Well, remember, it's a long project,
Right.
But all along, we'll be feeling that, oh, I'm just not living. It's not just another birthday come by, and now I can say, oh, I'm a little tired because I'm a year older, instead of saying, hey, I have a little bit more time to enjoy. I can have fun, and your mind and body together. What you're doing, the quality of life instead of just
And other
getting
people are
more.
going to look and say, like your patient said to you, what are you doing differently? And how can I do that too?
Yeah. Best way is to lead by example.
Yeah. Yeah.
You know, um, it is very unfortunate that if you ask most of the physicians, there was a survey taken,
Mhm.
how will you like to die?
Mm.
You know what they said?
What?
Not in ICU.
Not an ICU.
Not like my on a life support.
Yeah.
That gives an insight. There's an insight there because sometimes we know what we are doing there's nothing on the other side, but we are just doing it because someone has declared it as a norm.
Yeah. And that's kind of interesting in the videos we've been doing and in
Uh-huh.
all of the women featured in Women in Wellness. That's a common theme, that
Uh-huh.
lots of what we're doing is just because that's the norm. That's what's been expected. That's what's been taught. And it's time to break those
Who,
norms.
yeah. You know who made these norms? And I want to say lobbyists.
Mm.
And now it gets into probably what's not a scope of this, but there's a lot of politics behind it. Health doesn't need to go through politics. If someone or most of the population, most of us believe that once they get started taking a blood pressure medicine, they have to take it for the rest of their life. They have a customer for life without even saying anything. And that seems like a good model. Once it is done, someone just takes that pill, add more, and then more, then few more to counteract the side effect of more. While on the other side, it is accountability. Okay, did you do this? Did you do this? It's hard work.
Mhm.
So, it is sad to see that that's how the health system has come to. I mean, we spend so much money in health system in our country. But if you look at the quality of life or life expectancy, we are way down. 50th, we are behind many even developing countries. That's not okay.
And so that brings us back to the
So
blue zone and
that brings
our
us back to the blue
choices
zone.
and the
Correct.
consequences of our choices.
Yes. We can't change the consequences of our choice, but we can change our choice. And it has to be I'm all for, we're a free country. Nothing can be forced on anyone, but they should be given a choice.
Mhm.
Right now, when something becomes abnormal, you're not given a choice. You just, okay, this is your option. When this happens, you just do this. You take this pill for it. If your knee is hurting, you take a pill. And you keep taking a pill till your gut is ripped apart.
Or till you have to have surgery because the pill isn't
Yes.
working any longer.
Yes.
Yes.
So that's not okay.
Yeah.
And it is a different approach. It comes only by education. You can't act on something if you don't know it. So I believe very strongly in creating the blue zone is an educator for our community.
Yeah.
Get the message out. It's possible.
Yes. Yes.
Yes.
And I'm looking forward to seeing the blue zone in action this year and moving forward. I'm looking forward to everything coming from Dr. Meena.
Me too. I'm so excited about this project. Yes.
So if we want to follow along, if we want to learn more about both Heal and Cure and Dr. Meena, where do people go?
You can go to drmeena.com and there's our philosophy of care and what I believe in,
Mhm.
or healandcure.com. That's where I work, or call us. We are at 847-686-4444.
Great. Well, fabulous, Dr. Meena. I think we could keep exploring these concepts for an entire video series, but I appreciate your time today, and looking forward to continuing to work with you and helping to
Likewise.
educate people.
Yes. Likewise. It was wonderful to chat with you, Peggy, this afternoon.
Thank you, Dr. Meena.
Take care.